All right, today we're pulling back the curtain on a medical exam that honestly is a lot like a detective story. We're going to crack the case of how doctors diagnose a hernia, and you'll see it's a really fascinating process of piecing together clues. Let's get right into it. So, you've probably seen this, right? Maybe in a movie, maybe you've experienced it yourself. The doctor puts their hand on your belly and just says, "Okay, now give me a good cough." It feels like such a simple, classic move, but what are they actually looking for? What's the secret? Well, it turns out they're not just going through the motions. They're basically playing medical detective. They're on the hunt for specific clues that point to a super common condition. And that whole investigation, it kicks off with that one simple command: cough. And here is our prime suspect, a hernia. Now, what is that exactly? Put simply, it's when an organ or some tissue, usually part of your intestine, finds a weak spot in the muscle wall and decides to push its way through. So the real question for our detective is that what's going on here? And if it is, where is it and what kind is it? Every good investigation starts by surveying the scene, looking for anything that might have contributed. The doctor's looking for risk factors, anything that regularly increases pressure inside the abdomen. We're talking about things like a chronic cough, ongoing constipation, or even a history of heavy lifting. These are basically the perfect conditions for a hernia to show up. So the first real step in the physical exam is just observation. The doctor has the patient stand up and then they just look. They scan the key areas like around the groin and the belly button. And you'd be surprised how often the very first clue, a visible bulge, is just hiding in plain sight. And now we get to that famous cough. See, when you cough, the pressure inside your abdomen shoots up. If there's a hernia, that pressure will push it out even more. So if that little bulge suddenly gets bigger or even appears for the first time, bam, that's what doctors call a positive cough impulse. It's our first solid piece of evidence. Okay, so we've got a visual clue. Now it's time for the detective to get hands-on. This next phase is all about palpation. That's the medical term for using touch to gather more detailed information about what's going on under the skin. By gently feeling the area while the patient coughs again, the doctor can literally feel that impulse, that push. It confirms what they saw. But they're also gathering more data. What's its size, its shape, its consistency? Is it soft? Is it firm? Every little detail helps build the case file. And this leads us to a really, really crucial question in the investigation. Is the hernia reducible? That's just a fancy way of asking, can the part that's poking through be gently guided back into its proper place? If the doctor can gently push that bulge and it disappears back inside, we call that a reducible hernia. And this is a huge finding. Why? Because it tells us that the contents aren't stuck or trapped in that weak spot, at least not for now. Now, for swelling specifically in the groin area, there's another clever little test. The doctor will try to feel for the very top edge of the swelling. If they can't get their fingers above it, because it goes all the way down into the scrotum, that pinpoints it as an inguinoscrotal hernia. It's a perfect example of how these simple physical tests can really narrow down the possibilities. So at this point, we've pretty much confirmed there's a hernia, but the detective work isn't over. Now it gets way more specific. The next goal is to identify the exact type of hernia. And this is super important because not all hernias are the same. And knowing the exact culprit helps determine the best way to surgically fix it. Let's see how they do it. Okay, this right here is a classic, the deep ring occlusion test. It's a cornerstone of hernia diagnosis. So here's how it works. First, the hernia is reduced, pushed back in. Then the doctor finds a very specific spot called the deep inguinal ring. You can think of it like a natural tunnel through the abdominal muscles. They press firmly right there, basically blocking the entrance to that tunnel. Then they ask the patient to cough, hard. And the result of that test is just brilliant. It's a simple yes or no answer. If the hernia doesn't pop back out when they cough, it means it was an indirect hernia that was trying to come through that tunnel the doctor was blocking. But if the hernia still reappears somewhere else, it's a direct hernia, punching straight through a weak spot in the muscle wall itself. It's an amazing diagnostic trick that gives a crystal clear answer. Now, for an even more, I'd say, elegant technique, some highly skilled doctors use what's called Siemens three-finger test. It's a really slick way to check for 3 different kinds of groin hernias all at the same time. It's pretty cool how this works. As you can see, the doctor places 3 fingers over 3 different potential weak spots in the groin. When the patient coughs, the doctor just pays attention to which finger feels that telltale impulse. If it's the index finger, it's an indirect hernia. Middle finger, direct. Ring finger, femoral. It's an incredibly efficient and frankly elegant diagnostic tool. Of course, the investigation isn't just about the groin. A good detective checks all the angles. They'll also look for umbilical hernias, right around the belly button, and incisional hernias, which can pop up at the site of an old surgical scar. And they're always on high alert for femoral hernias. They're less common, but they're absolutely critical to find because they have a much higher risk of turning into a serious problem. And that brings us to the most critical part of this whole investigation. Because while most hernias can be managed, the doctor is always looking for signs of one specific, dangerous outcome, one that changes everything and requires immediate, urgent action. And this is it, a strangulated hernia. This is a dire situation. It happens when the tissue that's trapped in the hernia gets squeezed or twisted so tightly that its blood supply gets completely cut off. When that happens, the tissue starts to die, and that creates a genuine life-threatening emergency. The hernia becomes incredibly tense, it can look red, and it's excruciatingly painful. So this is the final, most urgent conclusion our medical detective can reach. A strangulated hernia isn't just a finding, it's an alarm bell. It means the investigation is over, the case is closed, and that patient needs to get into surgery immediately. It's exactly why all this careful detective work is so vital. The big takeaway here, a simple cough can tell an incredibly complex story, as long as you know exactly how to read the clues.